Welcome. We're going to be talking about investing in the future of digital wellness and mental health. We're with Telosity Ventures, and I'd like to introduce ourselves as well. My name is Faye 25 years of experience in healthcare, insurtech, consulting, and investments. I worked at Kaiser Permanente, Blue Shield, Deloitte's healthcare practice, AIG. I've been seeing amazing growth and opportunity in digital wellness and mental health. Having founded 3 of my own startups, I know it's a challenge for our startups there and the environment we're in. But having assessed thousands of innovations and piloting and scaling them, there's a real opportunity. So I'd like to introduce Anish.
Hi, my name is Anish Srivastava. It's a pleasure to be here at this conference. I'm a general partner at Telosity Ventures. Spent half my career as an entrepreneur in startups and the other half in corporate venture and innovation Fortune 500 companies. Last several years in the healthcare space, and the last 4 years very much so in the mental health space, specifically for adolescent mental health. And we're going to talk a lot more about that during this session.
And Anish and I have known each other for over 20 years. And just in all the researching and investing, we're happy to share our insights and guidance with you here as well. And having invested in this space and seen hundreds and hundreds of startups. So looking forward to our session here today.
So the digital wellness and mental health market is a very large market, $4.75 trillion globally. And this is at the heels of Faye and I have been researching this and looking at the early 2000s, and the rates of depression, anxiety, stress have risen significantly. And these are pre-COVID numbers. With COVID, I think all of these numbers have accelerated in terms of challenges that we're facing in society today in the US and globally. We know that 1 in 5 Americans have a mental health condition. The other thing that's really interesting is that a lot of mental health conditions start at age 14 or earlier, and they go untreated for 11 years. So that leads to more severe scenarios, sometimes substance abuse. There's a lot of challenges that come as a result of that. And so one of the things that Faye and I embarked on in 2018 was really thinking a lot about what can we do to nip this in the bud, and how can we help adolescents address some of their challenges early on, from early prevention to treatment and assessment and so on. This, for adults, represents $44 billion in losses in the workplace productivity just because of depression. So when you add up anxiety, stress, a number of other mental health issues, these numbers increase. And when you look at the impact to patients, only 10% of patients who have mental health disorder actually get effective treatment for it. So we think that there's a huge opportunity with the shortage of therapists to bring in technology-enabled solutions at scale to help everybody that needs help.
And with that, we've seen record-breaking investments in digital health, especially with the onset of COVID. We saw how our vaccines could be quickly deployed from that, the assessment and tests, digital and virtual health visits accelerating from that. We've seen large, not only investments, the number of startups, the IPOs, the merger and acquisitions, and the activity. We see as our kind of aging of our global population too, as well as our seniors, the crisis in mental health being something that's going to continue as far as growing investments, number of deals, and innovation opportunities in this area.
And what Faye and I were doing was really landscaping the youth mental health market starting in 2018. And we couldn't find data that we felt represented adolescent mental health startups and what was happening in that ecosystem. So we started developing that on ourselves. And so as a result, what we realized is in 2018, there's about 173 startups in the mental health space. and only $59 million was going towards adolescent mental health from venture capital. Most of the money at that time, about $500 million, most of it was going towards adult mental health investments in startups. So we were the first to be focused specifically in this space, specifically focused on startups that were early stage in adolescent mental health. And what's been incredible is to see the growth rate that we've seen, that we've been tracking across this. So now not only do we have 173 companies in 2018 growing to 850 companies by the end of 2021, but we also see the venture capital dollars moving from 59 million to 870 million. And that's great. I think we're just hitting the tip of the iceberg. I think for those in the healthcare space, you see that there's a lot of complexity and a lot of different aspects in the industry that need to be addressed, both from the provider side and the payer side, and obviously the patient side as well. And so over the next decade or two, we see significant opportunities that will continue to evolve in this space and develop. And in this process, as we mapped out 2018 to 2021, digital health investments, as you saw in the previous slide that Faye was talking about, grew by 3.4x. But the amount of money that's going in from venture capital towards adolescent mental health startups has grown 15x in the same period of time. So I think that there's a recognition that this is an important space. This is a space that requires investment. There's a lot of room for help and support for parents, for adolescents, for adults, for healthcare providers and payers. And I think there's a lot more to come.
I think the opportunity is amazing and significant. For every dollar investment in prevention and early intervention in mental illness and addiction yields $2 to $10 savings, whether it's healthcare costs, criminal, juvenile justice, low productivity. We estimate mental illness will cost the world $16 trillion by 2030. And looking at that, you might then look at kind of the 12 billion working days that are lost due to mental illness every year. With it, then we start looking at the people that are ages 10 to 24, 64.3 million. We know that the cost and indirect cost of this child and mental health, behavioral health, and mental emotional issues is $247 billion. As we're looking at it, we expect growth to continue and the demand to continue. But we're also seeing that adults and young people alike really want to incorporate technology into their mental health routine. They are on their phones, they're on the go, they're on their laptops, computers, and online. So how can that be an enabler? We know as the young population ages and as we look to the Gen Z population that's growing, that they're going to have the power and influence for $600 billion and then additional $44 billion in spend. So as we're looking for the future and kind of opportunities to address mental health and behavioral health, we see digital and technology as a true enabler to really have an impact on millions of people's lives, affecting trillions of dollars of cost and opportunity.
So one of the things that we've been tracking is in 2018, the bulk of the venture capital dollars and early stage investments into startups was going into early stage companies and smaller check sizes. So one of the things that we've been monitoring over the last 4 years is there a there from a growth perspective? Will later stage investors invest in this space? Will startups make the cut and reach the milestones that they need to be able to get that traction? How is that market that was nascent 4 years ago going to grow? So there was a lot of questions at that time, and we're happy to see that over the course of 2018 through 2021 and even early this year, there's been a lot of significant investments in the space. So in 2020, we saw 5 companies that had raised over $50 million. 2021, we saw 18 startups that raised over $50 million, which is super exciting. And some of these check sizes that you see in the rounds are pretty massive. So Presence Learning with $350 million, Cerebral raising $300 million in Series C, Sondermind raising $241 million, LME raising $219 million in Series B, and GoGuardian raising $200 million. And there's 15 other companies that are in that state where they've raised a ton of money, which brings unicorns into this market, into this space. Here, what you see is a mix of startups that are focused on adolescents only, as well as age agnostic. So there's a mix of mental health startups that are playing in this space, coming from a lot of different types of perspectives to address depression, anxiety, insomnia. So sleep is an area that's really interesting to us. And we can see Cerebral making a lot of strides in that space as well. So lots of interesting companies, lots of interesting deals. I think this is a testament for those companies to be able to have raised that much money. There's a lot of traction in the market with customer bases that they're growing. So we're pleased to see that. And as I mentioned, this opens and paves the door for the next decade or two of being able to provide a lot more innovation in this space. And we are seeing a growth of VCs getting into this space as well. So a lot of them have done historically one or two investments in the mental health space. And we're seeing growing interest from investors here.
We've also been seeing really notable exits in this area. What's been interesting, as Anish was mentioning, some of these larger size rounds have been really giving some of these emerging companies the ability to acquire other startups and really expand. When Anish and I were talking with our ecosystem and our strategic partners, whether they're providers, health plans, they're really looking for solutions that go across the care continuum that can address millions of their patients in need. So we're seeing that kind of being able to go across the spectrum and kind of address that being the kind of one of the main objectives. If you look at for example, Quartet Health, really, acquiring up in telepsychiatry, and that really looking at that kind of the virtual reality, the telepsych, the being able to really prescribe meds online from that and being open to that. As we look at Sondermind, really looking at complex and psychological and behavioral data and making that really scalable. We're seeing that data-driven insights for personalization and individualized care plans that are really addressing the need and trying to disrupt that metric that Anish mentioned, where it's taking over 10 years for people to find the right and effective care for them. So if we can disrupt that 10 years and only 10% really finding effective care, what could that be? We see the likes of kind of BetterUp, formal acquisitions with several startups as well, really understanding the customer and employee emotions and the data from that standpoint and really facilitating a better experience. Ginger and Headspace was one of the big ones that was kind of talked about. You probably saw some of the news in that space of the meditation and mindfulness of Headspace and the on-demand healthcare app with Ginger really merging together as a single company in Headspace Health. So with that, we've seen some great and emerging startups in this area, really working with evidence-based programs together with mobile interactive courses to digital primary care services, where we're seeing a lot of the mental health is first discovered in that area, as with K-Health acquiring a text-based therapy platform. We know that there's also a shortage of clinicians and psychologists and psychiatrists in this area. We've been seeing a lot of interesting peer-to-peer models, virtual care, AI, kind of online therapy, counseling, coaching services, referral, consultation is that as well. As we will continue and seeing trends as far as like Dario Health with Way Forward, where it's really about using that analytics, the machine learning algorithms, evidence-based programs to really manage mental health and digital wellness, as well as shared infrastructures to get therapists and patients back on track. So we think we'll continue to see a lot of notable merger and acquisition activity going forward as well.
One of the things that Faye and I did was we had a session with children's hospitals around the country. I think there was about 40 or so. And we were hosting a webinar talking about investment trends in the adolescent mental health space. And one of the things that we were trying to understand from them is what are some of the pain points in the areas that are important to them in behavioral health. And so it was really interesting to hear some of the points that were made. And if you look at this chart here on the right, ranging from IDing a more precise mental health medication regime, interactive self-guided mental health and wellness. This is to augment the work from therapists. So if it takes a couple months to see a therapist, but then in between sessions might be a month, what can you do in between that would be supporting? The third one that you see here is connecting patients with appropriate mental health providers. So being able to select the ones that are the right fit. There's so much subjectivity and personal aspects that go into the interactions between a mental health provider and the patient. And so that ability to be able to connect with the appropriate matching is really important. Screening is another important area. Remote monitoring between clinician visits so that you can have interactions that are short and sweet, but maybe app-driven or data-driven. And then the most important one was around early detection, because this really plays into the ability to prevent conditions before they become too severe or before you get into crisis modes where there might be risks of suicidal thoughts or suicide attempts, et cetera. So those are super important. And this is what was brought to us from the children's hospitals. And during COVID and during the pandemic, we saw about a 31% increase in ER visits, specifically focused on behavioral health issues. And so the pandemic just exacerbated the problem that was already there and brought something that was important to becoming urgent to address. And so there's a lot of appetite from hospitals, from payers, providers to look at the startup ecosystem and saying, we don't have digital solutions that solve all of our problems today. What's out there in the market that can help us? We're willing to work with startups. And we have a need because we're not going to be able to build this internally, and these solutions are not present today. So how can we address that? So this was very helpful for us as we think about it, obviously for the startups that are working in this space, and for the hospitals, it's really great to be able to see their appetite and openness to be working with the startup ecosystem.
We've been gathering all the learnings and considerations for investors and startups to really look at, and really understanding the impacts of COVID and what's been happening. We definitely saw with COVID the Great Recession, the impact for companies in having the challenge, especially small business, a move to increased mental illness, stress, anxiety, depression, suicidality, and as Anish was mentioning, even ER visits from that. We've also seen a real increase in resurgence in entrepreneurship. The number of startups in this area, the really kind of looking at our passions, what is needed, an increase in deployment of virtual care options, and really looking at kind of the challenge of our supply chain and also our providers, and really on the front lines. With this, we really then also saw how can we really address the broader needs. As we were looking at it, there was great consideration of how, not only from a mental health and reducing some of the stigma, as some of our Olympians, athletes, influencers were saying, I have a mental health issue, reducing some of that stigma. But then also looking at the science that's been looking at how exercise, sleep, nutrition actually affects your mental health, how even like ketogenic diets are really having a positive impact on bipolar disease. So from that, we've also been looking at the implications of where we really need to understand the needs. We need to understand the regulations that are happening in this area, the funding, the opportunities in this area, and then what and where do people want to go? We found that people, whether it's your employer group, your school, social media, online communities, in their nonprofit organizations and organizations being areas of people who are looking to seek advice. What we're seeing too is that what are you really considering and where you're looking at? As you're looking at, and as kind of startups and as investors are looking at, people are concerned as we look at digital solutions. How is your data being used? How are there privacy and security controls? How can it be personalized to me? I'm not a one size fits all. I have unique experience and unique needs. How will you address when I'm happy versus sad? Or are you only going to be my sad, depressed app? And, how can I know that I'm making progress? And how will my clinician know I'm making progress as well? These were some of the interesting questions and thoughts and considerations. And we've looked at hundreds and hundreds of kind of startups in these areas and things to consider as you're looking at it as well. As we looked at it, what we found is startups were addressing different customer segments. It could be health plan insurance groups that they were really working with and kind of really looking at the quality and efficiency there. It could be providers, doctors, front lines, hospitals, and where we're getting, as you saw, some of our children's hospitals kind of assessment and what they were looking at. It could be parents, it could be young people, it could be families, it could be communities from that standpoint, or it could be employer or companies, schools. And so we definitely saw the whole spectrum of different segments really trying to tackle it. We also saw legal and regulatory policies and funding really coming into this area as a need is being further recognized and adopted. And really then also looking at the strength of the diverse team, your diverse skill sets and experience having a real impact on the success of your company as well. I'll turn it over to you, Anish.
Thanks, Faye. So I think Faye started mentioning this, and there's a lot that we've learned over the last 4 years with a very hyper focus on adolescent mental health. We were seeing a lot of startups coming to us that were outside of our scope a couple of years ago around sleep, activity and fitness, nutrition, wellness in general. And what we're realizing and learned in the process is that as we were focused on adolescent mental health, there's a lot of adjacencies around that which affect the well-being and the mental well-being of an individual. And so as we thought about it, we also realized that a lot of the mental health state of an adolescent is impacted by adults around them as well. So there's a few things that we've been thinking about scope as we think about the future of what we're doing at Telosity. And so one of them is being age agnostic. So we want to be able to help the adolescent, but we also want to help the parents and the adults that are important to them because that has an impact directly on the adolescent. The other aspect that we want to focus on is that we were looking at mild to moderate conditions, and now we want to move up that chain to be able to address a broader set of conditions around mental health and mental well-being. Nutrition, as Faye was saying, there's a significant research that's emerging, a startup ecosystem emerging around precision nutrition, for different types of medical conditions, which I think is fascinating. So for mental health, it's super important, and it affects people's mood, how they eat, what goes into your body. There's a movement around food as medicine, which now you're starting to see some payers and insurance companies that are covering the costs of personalized meals that are specific to whether you have diabetes or heart disease, et cetera. And so that is also expanding into mental health space. And with the example that Faye had given around ketogenic diets and bipolar disease as an example where there's emerging research around that. We know that being active is a big part of not only your physical well-being, but your mental well-being and your state of being able to clear your head, being able to address stress, and a whole bunch of other factors. So there's a lot of apps there that are providing not only just the tracking, but educational components of it, how to be healthier and how to be able to track that and be able to see that, the impact of that in your mood and wellness. Sleep is another one, which is a very big factor. I think our circadian rhythms are impacted by the screens that we look at, and a lot of that is happening at nighttime. Phones, for a lot of folks, are next to their beds. They'll pick it up. That's not the only cause. There's a multitude of impacts to sleep that are affected by that, but it becomes a self-fulfilling issue or challenge to address when people aren't sleeping well. They're more on their screens and thinking about work at night and actually affecting their sleep, which makes them not in their optimal state of mind or well-being the next day during the workday or school day. So we also have a wellness bucket where we're saying that there's a lot of, if you think about the range of mindfulness to meditation to other types of techniques around wellness that are out there, there's whole movement of startups that are coming in to help you with social connectivity. So we know Gen Z is the loneliest generation to date. And so there's a lot of movement and innovation happening in the space of how can we impact wellness from other dimensions as well.
Just kind of clicking on that and diving deeper to kind of Anish's categories is we really, as we looked at hundreds and hundreds of companies, that the research, the effectiveness, what kind of the demand is and where we're increasing, it really is all the way from that health, prevention, well-being, all the way to access, care, and support across the care continuum from that. And this is where we really start kind of seeing it emerge, and our kind of focus areas have been across these kind of 8 categories, all the way from wellness and self-care. You've seen a lot in this space as it's kind of been growing, and that positive skill building, improved online experiences, kind of meditation, wellness, and skill building in this area. As we've also then kind of, as Anish was mentioning, that food is medicine. That nutrition, as we're going into it, how we're really looking at our gut biome and what it impact has on our digital well-being and our mental state from that standpoint. So wonderful research going in there, a lot of interesting kind of startups. And what we kind of looked at is basically activity from that. Is in the sense whether it's your fitness, activity, training, your healthy lifestyle. As we look at the social determinants of our health, we know that 10% only 10% is really the traditional healthcare going to your doctor. That other 90% really is really looking at kind of your activity, your sleep, your nutrition, your environment, how you're going about your life from that standpoint. So as we then kind of going into the kind of sleep and the treatment of these kind of disorders, really letting our minds reset and rest from that standpoint. Some great research on that. Exciting category, I must say, about emerging technology has always been a passion of mine from that standpoint of having led Kaiser Permanency's Innovation Lab and Fund and AIG. It's amazing whether it's virtual reality and extended reality, really taking you to another world, retraining you and your mind to think differently about a situation through immersion therapies that way. Whether it is Internet of Things and kind of sensors, really being able to understand and personalize for your treatment, to artificial intelligence from this standpoint. So we're seeing a lot of great work happening in this area as well. We know too that you only visit your doctor or your clinician, only several times a year, or if you're lucky, you can get that monthly visit. What is your engagement and support between those visits? How are you able to connect, monitor, manage, engage, and comply with your plans for that. So we've been seeing great examples in that, whether it's chatbots, peers, coaches, electronic medical records tied to activity monitors and sensors from that. And last but not least is that assessment, really being to assess early, as we saw a lot of the hospitals are saying, being able to have that early intervention and early assessment to the access to the right care for you from that. So as we look across this whole care continuum, as well as the opportunities in mental and behavioral health, we think they're great from that. I'll turn it over to Anish to kind of dive into some of the companies.
Yeah, and I know in the interest of time, Faye and I are going to try to buzz through this next couple of slides so that we can wrap up here. But we've got some amazing companies that we've had the opportunity to work with closely. Daybreak Health is a teletherapy service specifically geared towards high school students. They have done a phenomenal job with their understanding the market, product market fit, growing their business, and just recently raised a Series A a couple months ago. Sana Health is a very interesting company that's really bringing objectivity and measurement into assessment, which they're revolutionizing this space. Maslow has amazing technology rooted in artificial intelligence and building an empathetic AI. So there's a lot of learning that goes on in their platform, and it's a platform-based approach. So a lot of other tech-based companies or customers are able to tap into that and incorporate into their services. My Life's a mindfulness and meditation app. Flipped is something that's focused towards students and helping them be more focused with their time. MindRight is a startup based out of New Jersey, working with payers, and it's really bringing culturally responsive coaching to Latinx and African American youth. Neoth is providing stress and mental health resources for students with a self-guided platform. And Manatee thinks holistically about the parents, the therapists, and the child with apps focus on all of them and really about what happens in between sessions. So I'll hand it over to Faye.
Wanted to say we're upcoming market guide for investors and entrepreneurs with really actionable insights, market landscapes, deep dives. So please see us at Telosity.co. It's going to be coming out shortly in June. So we're so excited and we can dive deeper since we're out of time going from this. And I'll turn it over to Anish to close up.
Yeah, and just a little bit about us. What we've been building is, as we were the first to focus on youth mental health startups, we have been developing a lot of relationships in the ecosystem with mental health organizations, with individuals that are well known. We're seeing a very strong pipeline and continuous inbound interest. If you know of any interesting startups or you are a startup that's in this space, please reach out to us. Same with investors. We're happy to continue building our network and learn from each other. And we've developed a very strong platform because we lean in and help our early stage, pre-seed and seed stage startups in the market. So we've got a host of support mechanisms that we bring with our platform. So this is a pleasure to have been part of this conference and this session. Hope you found some value. Thank you very much for listening to us.